Today, first, we are going to talk about menstrual health. So, you are all quite grown up, you're already having periods and everything. So, this is sort of a grown up version of the talk. So, here you can see the uterus is in the pelvis. In the front of the uterus is your bladder, and the back is the rectum. So the uterus appears like this. A non-pregnant uterus is sort of a size of a pear, and the cavity is slightly triangular. That's the cervix, vagina. The cavity is connected to the tubes, and the ovaries are on either side. Now, contrary to the popular belief, or as we show in the diagrams, ovary and the tube are not stuck to each other. Rather, they are separate. They are just in a very close proximity to each other. And inside the uterine cavity, there is a lining, which we call endometrium, which is prepared every month as if you're going to be pregnant. And if you don't get pregnant, the lining you shed as a period. And ideally, it comes only once a month, lasts anything between 3 to 7 days. The blood comes out of the vagina, and it doesn't come from any cut or an injury. So nothing to worry about. So this is sort of a general idea. So your period starts for 3 to 7 days. So the first half of the cycle is driven by a hormone called estrogen, and that builds the lining. In the middle of the cycle, you release an egg that is picked up by the tube. And the second half of the cycle is driven by a hormone called progesterone. Once the ovulation happens, in next 3 to 4 days, fertilization happens, meaning the woman gets pregnant. If that doesn't happen, the lining is shed. When you start the period, the initial phase, all your hormones are changing. Your body is sort of getting used to the periods and everything. So it takes a while, but within a year or so, your body will have gained full control of the periods and everything. And every individual will realize their own pattern and rhythm and identify any aberrations in it. So this is a bit more detailed because you're grown-up students. So when the FSH hormone, so this light blue line, its name is follicle stimulating hormone. This hormone comes from your brain and it stimulates the follicles in the ovary. Now, if you compare ovary with an orange, all your eggs are in the peel of the orange. And the peel is just blood vessels, supporting tissue and everything. So some of the follicles are recruited, but only one of them grows big enough. And as they are growing, they are producing the estrogen hormone that is building the lining. In the middle of the cycle, there is a surge, we call it of LH hormone or a luteinizing hormone. And this surge makes you release an egg from the biggest follicle, which is a dominant follicle. And then the follicle collapses, gets filled with the fat cells, and that produces the progesterone hormone, which makes the lining make it more receptive to receive the pregnancy. So if pregnancy happens, the woman continues. If pregnancy doesn't happen, the corpus luteum dies in 2 weeks. The hormone levels drop. These blood vessels, they shrink, and the period starts. Okay. So what you might feel during your period. So mild lower abdominal pain is common because the uterus is constricting and trying to push the blood out along with the lining cells. Some back pain, you might feel tired. Mood changes are quite common. You might crave certain food types. Some of you might not feel anything at all, and some may be uncomfortable. And actually, both things are absolutely fine. You can't, like everything else, we are all unique. We all have things in a different way. Similarly, your periods are. So not necessarily that if your friend is bedridden because of the period pain doesn't necessarily mean that you should experience the same. And if not, there is something wrong with you. So everybody is different. And as I said, that you will find that rhythm. So some girls may experience that they're starting to get pimples just leading up to the period. And as the period starts, the pimples disappear, or they might experience some breast tenderness, some vaginal discharge. So you will identify these signs. As I said, it was 3 to 7 days, which is a normal duration. Sometimes it might be a bit extended, or even in those times, the period flow might be heavy and you are actually losing your blood. So, blood contains hemoglobin, which carries oxygen. So, if you have heavy periods, you may lose blood more, and because of that, your hemoglobin will go down, your oxygen carrying capacity goes down, and that's what makes you feel a bit tired, lightheaded, and everything. So, taking care of yourself during your periods. So, you need to rest whenever you need to. You need to drink plenty of water so you're well hydrated. You need to eat healthy food, gentle exercise, walking or stretching, but basically, whatever you feel comfortable, you can do. There is no restrictions on you as such, what you can or you can't do. Some girls use warm water or hot water bottles for lower abdominal pain. You can take painkillers as well. They're pretty common to use. But in an ideal world, no period should stop you from going to school or play or do any physical activity. Okay. Menstrual hygiene is very, very important. And if not taken care of, it can lead to really massive problems. People have died from infections got during the menstruation. And that's why it is very important to keep clean and healthy. And there are lots and lots of menstrual products are available on the market. So pads, majority of you would be aware. This is a new thing. I don't know if you have heard of it or used it. It's called a menstrual cup. So it's a silicone cup which actually folds, and then you insert it in the vagina and the blood collects in the cup, and you just empty it, clean it, and reuse it. So basically, in places where pads can be quite costly or not available, or uh, people who are very, very conscious about their carbon footprint and environment, this is an amazing innovation because once you buy it, you don't have to change it until it is lost or damaged, which is unlikely because it is made of silicone. Then you got tampons and period pads as well. So whichever product you use, you make sure that you change it at a regular interval. We do say like 4 to 6 hours, but that is like even if it is not soiled. So if you have heavy periods, it is quite possible that you might have to change it often than 4 to 6 hours, but that is your maximum duration. You need to make sure that you wash your hands before you change it, and after you change it, you dispose of these products because this is a biological waste. So you have to dispose it off properly. You need to take shower or bath on a daily basis. Wear clean underwears, preferably cotton ones, so the sweat won't accumulate. Keep your private parts clean, because if we get plenty of times we get patients who actually lose their tampons in the vagina, and that can be quite dangerous. It can cause streptococcal infection, and people have died from it. So you need to make sure that you are whichever product you're wearing, make sure you change it and don't forget to remove it and dispose it off safely. Um, do not use any soap inside the vagina. So those vagi cleans or vaginal washes or douches or whatever, no matter how natural or herbal or pH balanced those products are, they are actually harmful. So there is a non-harmful bacteria in the vagina. It's called Dodderlin's bacilli. And what they do is they break down the glycogen in the vaginal mucosa and turn it into lactic acid. And this acid keeps the vaginal pH to acidic level. It's around 3.5 to 4. And there is a very natural reason for it. Because of this acidic pH, it doesn't allow any harmful bacteria or fungi like Candida to grow in the vagina. So you can see how amazing your body is, that it actually takes care of itself. Your vagina is self-cleansing and does not need anything other than plain simple water, which has a neutral pH. So if you use any other product, this natural balance of the pH is disrupted, and that can lead to different problems like persistent itching or a persistent discharge, or sometimes recurrent candida infections and other infections. And that's why, please, please, please do not use any solution inside the vagina except plain simple water. You don't need to be ashamed of your periods, or you don't need to hide their periods, because they're not dirty. It is as natural as you eating, drinking, sleeping, and going to the loo. After doing these sessions, we came across quite a few of myths, and we just want to sort of talk about them as well. So some girls said that they are told not to play. It is, as I mentioned earlier as well, there is no restriction. As long as you feel comfortable, you are free to do that. Okay, period blood is dirty. That's totally wrong. It's actually normal body blood. Okay, it just mixed with the lining cells, but there is nothing to be sort of ashamed or feel dirty about it. Okay, it's like when you get cold, your nose is full of mucus and you're blowing your nose off. So it's exactly the same. Okay. Only adults get periods. That's not right, because there are certain conditions where girls as early as 6 or 7 of age, they can get periods. Obviously, that's a pathology and that needs to be investigated. There was another myth that you can't eat certain foods. So that's not true. As long as you're not allergic, there is no restriction. All we say is make sure it's healthy. Okay. When do you have to tell an adult or a doctor? Is when the periods are very heavy. And as I said, that now your body is accustomed, you must have figured out your own rhythm and the duration. So if, let's say, normally you bleed for 4 days and you change like 3 to 4 pads a day. Okay. So now suddenly from last month, you are experiencing that actually instead of four, you're bleeding for 6 days. And instead of changing 4 pads, you need to change like 7 or 8 pads. So yes, that's heavy bleeding. Or severe pain that's stopping you from activities, like you can't study, you can't walk, or you just have to stay in bed, or you have to take strong painkillers very regularly, or periods are not stopping after many days. So as I said, 3 to 7 days, but it's been like 14 days and you're still having bleeding, or you're feeling scared or confused about what's happening. So please talk to your mother, older sister, or teacher, or a school nurse, or a doctor. Okay. So in summary, the puberty is normal part of growing up. The periods happen once a month and they last for few days. You need to use always clean products and change them every 4 to 6 hours. Stay clean, take shower every day, and wash your hands before and after changing your products. You need to drink plenty of water, eat healthy food, and rest wherever it's needed. Periods are not dirty or shameful. And if you're worried about anything, talk to a trusted adult and seek help.